Hi everyone! Thank you once again for staying tuned to my weekly Sunday 9 p.m. live video. And I'm actually very excited over today's topic and the following topics as well. I'll be having a series of topics for every week for the next consecutive weeks, all dealing with just solely one thing: maternal emotional health. And this part of maternal health is something not many people talk about. We all know it exists. We all know it's a problem. We know it has a lot of effects to the baby, to the growing up child, to the lady herself, to the husband, to the entire family, but nobody wants to talk about it. And I know that emotional health is also something that when we as a trainee, when we take exam, when we are student, we take exam, we have to fill that up. We will write about it, we talk about it, we go for our viva exam, we talk about it. But in reality, how many of us actually deal with these things in day-to-day practice? Sad to say, doctors on the whole are very focused on the physical problem, but rarely looking at the emotional side of pregnancy, of motherhood, of childbirth, that actually we have actually neglected a big lot of it, and it has actually consequences to the lady's health, the baby's health, the family health. And that is why I decided to bring this up, not just because partly one of you suggested postnatal depression, and I was thinking it's not just depression I need to talk about. It's not just postnatal depression. That maybe is the commonest thing people talk about, but there's so many aspects of emotional health in a mother that can actually affect both the mother and the baby, and as well as the entire family surrounding her. That means including the husband and all other people around. So today we're going to start on postnatal blues versus postnatal depression. Is there a difference? What is postnatal? Postnatal means something that develops after delivery. And we say strictly it must develop within the fixed 6 weeks after delivery. It usually starts then, and then it may continue further or it will end then. Some people just during confinement, that's it. But some people, this depression can go on for the rest of their life. And it's actually a reality, because I've been seeing pregnant women, as obstetricians. We see you when you not yet get pregnant. We see you when you get pregnant, your first baby, your second baby, and maybe your third baby, your fourth baby. There's so many women that we see right from very young till a lot older. I'm not that old yet, but I have seen some mothers, some women, for the last 10 to 20 years, the same person. And we see them changing. We used to see a young, beautiful, cheerful lady who comes and see us before she's ever pregnant, or during the first pregnancy, the second pregnancy. And sometimes things start changing. And over the years, we see them, why they are a different person now. Last time they used to be cheerful and happy. Now they come, they don't even bother to dress up. The makeup is no longer there. And you can see like they age so much, Sometimes we see them like every year, and there's 1 year when they walk in and you see they age so much. What has happened? Something has happened. And then a lot of other things start to surface. They tend to have a lot more problems with their physical health. No more fibroids, more cancer, more endometriosis. Out of nowhere, you look at a different person. I have also seen women where, when I used to see them during their younger days, we look at them, they're happy, we can talk eye to eye. And today, what happened? There's no more eye contact. The person looked different. She looks like she's somewhere else. What happened? And then when we talk to them a bit more, then only all these stories reveal. You hear a lot of depression coming in. They will start telling you that they have depression, they're taking medication, And not only that, when you go into detail as to when it all started, very often it started postnatal. It started postnatal, but because nothing effective was done at that time, it dragged on, and now it's no longer postnatal. It's 10 years later, and the lady is getting from bad to worse. So it's very sad when we see women like that who has changed over the years. And sometimes I also pity the husband, because when he married this lady, it is a different lady. Now she's a different lady, and I think it's not easy for him to cope as well. So the effects on the lady, on the man, and not to forget the children. Definitely, when you have postnatal depression, you affect your child. Definitely, the child's future is all different now compared to if you were happy and without depression, your child's future, and now you are depressed and your child's future is no longer the same. We know that children who grow up with parents with depression do not usually have such a good outcome compared to children who grow up with parents without depression. So all these things is sad to see, because number one, we know there are things that could have been done. There are things that could have changed everything. But we don't do it. We don't do it. Sometimes we want to do it, but maybe somebody is not willing to do it. Like some cases when I identify this lady, high chance postnatal depression. For me, I identify. Maybe sometimes as a doctor, I fail to identify. But at times, we manage to identify. And we think they need to do something about it. But maybe the lady herself not willing to walk the path. Or she's willing. The husband is not willing. Sometimes the husband is willing, but she's not willing. So it is not so easy to manage all this emotional health issue. Is because there is always a denial, that they always feel that no lah, I'm okay. Or they are very worried. Why I need to see these people? Am I crazy? No, you're not crazy. You are normal. It's because you are normal that we want to make sure you don't become crazy in the future, you know. But they have this type of stigma. Why must I go and seek help? Or they think that it's okay. Or as the common thing that I always hear, I'm okay, I can cope, I'm fine. There are so many women out there that always think that they can do it. But what if they cannot, and it's too late to turn the clock back? Okay, let's go back to what is postnatal blues and postnatal depression. Postnatal blues is quite common. In fact, it's more common in first-time mothers. And you usually see them, normally it's quite common. I think many of you also experience, sometimes after delivery, you tend to cry more. A bit, you cry. A bit, you cry. You're just very sad. And yeah, sometimes you're very lost. You become very moody. You tend to cry. That is postnatal blues. Postnatal blues is very common. It's very, very common. And we don't consider it as abnormal. That is still fine. You tend to cry. You need somebody to come and sayang you, to comfort you, to hug you, to say something nice to you, and that will solve your problem already. So postnatal blues is not a very severe condition. It's more common in first-time mothers, and usually it's due to lack of support. So what we need is support. So that's why Asian form of confinement, in a way, tend to have more support. Like we tend to stay with someone. We tend to stay with someone that can give us support. But unfortunately, some women don't stay with someone with the right support. They may stay with someone that never give them the right support. That's why I always say, it's very important where you have your confinement. It's very important. It has to be with someone that you really want that person to be with you. You know that person can always support you. If you think that the person that can support you is your husband, then you must have your husband in your confinement. No point you balik kampung to have confinement with your mother, with your mother-in-law, when the most important person in your heart, in your mind, is your husband. Then don't do that. Don't do that. Be with your husband. You want to go back and have confinement with your mother or your mother-in-law, or maybe you invite your mother to your house or your mother-in-law to your house. The very first question I need you to ask yourself, is your mother able to give you emotional support? Is your mother-in-law able to give you emotional support? Is your relationship with your mother good? Is your relationship with your mother-in-law good? If not good, please don't. Don't go and think other things. Find other alternatives. Because if your relationship is not good, then you don't get the support you want. Because you're bound to be sad, you're bound to cry, you're bound to be lost, and you do not know what to do. And the worst thing to have is the person next to you never say the right things. Maybe say the wrong thing all the time. Okay, like I know this lady, she stays with her mother for confinement, but she cannot get along with the mother. Quarreling, arguing every day, clashes in opinion. What for? Don't want your mother in your confinement. Look for someone who can give you the support. The someone who can give you the support not necessarily must be your mother or your husband. It can be your sister. It can be your best friend. It can be just any other mothers. That's why something that is going around now that is a bit, or I would support at times, is confinement homes. Why? Because you have many mothers there, all having the same problem. So it's like a support group, you know. It's like an emotional support group. So they support each other. That could be better. Best still, of course, if you have a confinement home that can supply, that can provide emotional support by professionals. They have group support therapy once a week, where everybody tell out their problem, and there's somebody professional who is running it, who can solve your problem. I think that is the best. But if you're going to be at home, then you must ask yourself, who is the person you need to support you? So are you going to stay with the right person? If not, then you need to look for other alternatives. Sometimes I feel they are many women are very fixed with, it's either mother, mother-in-law, confinement lady, or confinement home. Why only these three options? Why not me and my husband and a maid? And just make sure my sister talks to me 2 hours every day. Or my best friend talks to me 2 hours every day. You know, things like that could make hell of a difference. You need someone who can help you with the day-to-day job, taking care of the baby, and things like sweeping the house, cooking, getting the food ready for you. Can be a maid. Doesn't have to be a confinement lady. Your confinement lady, can she support you? Maybe she can. But some confinement ladies are very bossy. They decide everything for you and you may not be happy. Then don't want. Can you click with the confinement lady? Then if can, then of course that's the best. If not, then don't. Can you click with your mother? Can you click with your mother-in-law? Don't end up having the whole confinement so stressful and so gloomy, and that's when you have postnatal blues. So we don't want postnatal blues. So you can always choose different alternative. Or you can just get a confinement lady that comes and do just basic things and go back. Come and cook for you, take care of your baby, office hour. At night your husband is around, you're fine. Things like that is still possible. Or a maid 24 hours that takes care of your baby and help you to cook. I think that's enough. But you need some social support. Maybe your husband is around. I think if you need your husband, it's better like this than to go back to kampung and your husband cannot be there. And then you'll be crying and suffering there. What's the point? So always look for social support. Social support during confinement is very important to prevent confinement blues. So now we are talking about blues. let's jump to postnatal depression. Depression is not the same. Depression is not blues. What is the difference between depression and blues? Depression is depression. What is depression? They are not just feeling very down. They don't want to come out of the room. They don't feel like eating. They got no appetite to eat. They don't feel like mixing with people. They don't want to talk to people. Sometimes they don't want to see the baby also. They just want to stay in the room and look into the ceiling or keep crying. Don't want to talk to people, not interested to do anything. And they have sleeping problem as well. They have difficulty sleeping at night. They tend to stay up, thinking of a lot of things. And some of them, of course, to the extreme, they may be suicidal. And also, they also may be hearing things, seeing things. And that is the extreme. Of course, if they are hearing things and seeing things, that is very, very extreme. But I have this one mother. After her first childbirth, she has always been hearing things. She has been hearing things even in her second pregnancy, third pregnancy, during pregnancy, just never stopped. There's always someone else talking to her. And it all also started during her postnatal period. So, but what we also worry is depression that can cause self-harm or harm to the baby. Maybe they want to kill the baby or they want to kill themselves. These things have always happened. Postnatal mothers kill baby. She's so depressed, she feels the baby is the cause of all her suffering, so she killed the baby. We have seen mothers who jump down of the whatever high building together with the baby. They kill themselves with the baby. So this is the thing that we worry most in confinement. We worry women go into depression, and yet nobody seek help. And at the end, they get worse, and they start thinking about either killing themselves or killing the baby. But these things actually, again, can be prevented. You don't just get depression out of nowhere, you know. You don't get depression out of nothing. Usually, number one, they already have some depression even before they give birth. Sometimes I just like to know, I have a tendency for many cases where I just give you a depression questionnaire form to fill up in my clinic. Then you fill up, you tick all the things. Yes, no, yes, no, yes, no. You just fill up everything. Then they count the points to categorize you either mild depression, moderate or severe. There are a lot of women out there that just look like you and me, working like normal, behaving like normal, have a regular job, stable job, have husband, normal relationship, stable relationship, but they actually have in the questionnaire moderate depression. When you have moderate depression, walking around everywhere, you can still cope. You tend to be a bit depressed. Maybe you don't sleep so well at night. Maybe you don't feel like mixing with people a lot, tend to be more quiet, but you're still fine. You can still go out to work. You can still earn a living. You can still click with your husband, and you are in a stable relationship, but you actually have some amount of depression, tend to feel down most of the time, but you're still fine. And these are the women, when they get pregnant, then they're still fine, but some of them you can see during pregnancy they get worse already. The sleeping problems worsen, the mood become different. They'll tell me they have no appetite to eat, not just first trimester, they have no appetite to eat for all 9 months. Then they start to be more closed up, don't mix with people, tend to be more moody, crying all the time, very sad, cannot sleep. And at the end, when you wait until after delivery, what happens during delivery is one thing. Something may have happened during delivery that tipped them off, like some not so good outcome. Let's say traumatized by birth, or suddenly they have not so good outcome. The not so good outcome need not be baby got problem, mother got problem. No, give birth normal, baby well, mother well, but maybe traumatized. The pain was horrendous, way beyond their expectation, and they cannot accept it. Or maybe after baby out, the baby cry, they cannot accept it. Why baby cry? What am I supposed to do? Or maybe cannot breastfeed, no milk, no, simple things like that, where most women can cope, but these women may not cope. And that is when you tip them into depression. That is the first factor. And the second factor is what happens again in the support, the postnatal support. Are we all doing the right things or saying the right things? Sometimes what the surrounding people say, or even at birth what the nurses say, the doctors say, can also tip them off. It's like sometimes, doctors like to say this, horrible doctors. Doctors are very guilty. Midwives also very guilty of all these things. It's like we always tell patient, you better push harder, if not baby lemas. After your baby heartbeat drop, you better push harder. If not, your baby will be short of oxygen. All these words we say, maybe with the intention to motivate the mother to push harder. Yes, it works. Most of the time it works. Mother will push harder. But you actually don't know. A lot of mothers think that it's their fault. Must be, I didn't do well enough. Baby is going to be deprived of oxygen because of me. Baby is going to lemas because of me. Something is going to happen to my baby because of me. So all these things can actually tip a lady off to depression after that. And then the birth itself, what happens after that? The support. Is there somebody to really support the mother emotionally? So all these things can tip a lady to depression, full-blown depression. So you must understand, most of these women already have some depression. Maybe mild to moderate depression before they give birth. But they are tipped off to severe depression after they give birth. Or something else happened after they give birth. Maybe the husband start not to come. Or husband got another woman. Something must have happened during the pregnancy, the childbirth. But originally, these are already women with some amount of depression. So my question for all of you, have you actually seen these questionnaires and try to answer and see where you stand? I'm sure you can Google one on internet. May not be the latest or the standard one that we use by all medical doctors and psychologists. But anyone, just get one questionnaire, fill it up, see where you stand. Are you mild depression, moderate depression, severe depression, or no depression? If you are mild to moderate, especially if you're moderate depression and you're pregnant, I think it's better you seek help when you're still pregnant before something actually happens. Why? Because childbirth is out of our control. The pain is going to come. There's nothing I can do. Whether you are a easy birther, difficult birther, it's not within your control or my control. Maybe you are lucky. You go in hospital 2 hours, you give birth and push 3 times baby out. Lucky. But maybe you are not so lucky. You are the type that will take 20 hours to give birth, pain for 20 hours, and then push for 2 hours. You may not be so lucky, but actually the outcome is okay. Baby is well, you are well. But the experience you went through may tip you. Jaundice, milk supply, sometimes all these things is not within your control. And other things that can happen, maybe to you, your husband, you won't know what's going to happen. I have cases where they found out the husband got another lady during confinement. How? Again, not within your control. Yes, you have a horrible husband, but it's not within your control. So, but when you go into depression, it affects the baby. It affects the baby. Because baby, we know the development of the baby, the immune system of the baby, the growth of the baby, And also the character building of the baby very much influenced by whether the baby gets enough love. Love and care from the mother is very important. But once you have depression, you don't want your baby. You hate your baby. You want to kill your baby. Where is your love and care for the baby? Then this baby will be down. Emotionally, physically, the health, the growth, the mental growth, the physical growth. You will see the baby won't grow as fast. The baby's growth will slow down. Mental growth of the baby also will slow down. The character of the baby also will be difficult, tend to be a difficult child, difficult to care, and grow up to be difficult children, disciplinary problem. It's all because of the depression. But this could have been prevented if you seek help during pregnancy, not after. First is during pregnancy, seek help. So these things, you need to first identify. That's why sometimes when mothers tell me, I cannot sleep. Oh, to me, I cannot sleep. See the therapist. You must see the therapist so that you can sleep. Because that are some early signs. Because they may not tell me they are crying at home, but they will tell me they cannot sleep. These are early signs. Have to go and see therapists. Get it sorted out now so you can sleep again and you're happy again. So that whatever happened after that is fine. Then after that, if not, then during postnatal period, someone must be able to identify that the wife is not normal. That is also a problem as well. Because a lot of times they don't realize. Especially there is a culture whereby confinement lady take care of the baby, mother take care of herself. So you see someone is taking care of your baby and all you are interested is staying in your room the whole day, never come out. So you stay in your room the whole day, never come out. People thought you're fine. That's not normal, yeah? That could be early sign of depression. Because the mother, when is not interested with the baby, is an early sign of depression. It is already depression now. It is something you need to take note and you need to bring her to see someone. Professionals, psychologists, therapists, psychiatrists, professionals that deal with depression. But what the biggest hurdle we face today is, number one, lack of identification. A lot of times during pregnancy, it's missed. The signs were there, but somebody just missed it and never do anything. Or during the confinement period, obviously you have depression, but everybody thought it's normal. That is the first hurdle. Second hurdle we have is when we identify and the lady refuses to seek treatment. They think they are fine. I'm okay. Especially the pregnancy period. Pregnancy period, a lot of them, they feel they're fine. I'm more or less like that most of the time. Because these women, they have some amount of depression all their time, all their life. They think they're fine. But actually, they're not fine. Or the husbands may feel that, no need lah, we can cope one. So it's always somebody that is stopping them to seek treatment early. And not to mention the taboo. The taboo about, I think I'm not crazy. They always thought that I'm asking them to see the therapist because they are crazy. No, they're not crazy. I'm asking them to see the therapist so that they don't turn crazy. Because if you are full-blown depression, you'll be seeing things, hearing things. Yeah, that time you're full-blown crazy. We're asking you to see that so that you don't be crazy. Because childbirth is something out of control. Postnatal, a lot of things can happen out of control. It's out of control. But so you need to be mentally healthy, emotionally healthy to cope with whatever possible outcome. During confinement period, we also have hurdles also sometimes. Very often when it's identified by the family members, but it's already full-blown depression. Full-blown depression, these women don't want to get out of the house. You can't even get them out of the house. They want to keep themselves inside. They don't want to go anywhere. Literally, I see husbands dragging their wives to my clinic. But when they are in my clinic, sometimes also it's not easy to deal with cases like this because they can be very resistant at times. It's not easy to deal with, to treat a full-blown depression compared to I just treat a moderate depression before give birth. That one easier. Get it sorted out. Depression before give birth, 3-4 visits, most of them are fine already. They'll be mentally ready to cope with the childbirth and the postnatal period. But if you don't come, you don't seek treatment, that is very hard. Then you wait until full-blown. Full-blown, if detected late, number one, full-blown depression, many of them will be on long-term psychiatric medication. And some of them cannot get out of it even after the postnatal period. Then they'll be on. Some of them can get out of it after the postnatal, but some cannot. Then they'll be on depression medication forever. And in fact, this video, I always feel that it's very important for husbands to watch this video because they don't realize the severity of it. I always feel the one that suffer most is the husband, because living with depression is not easy for people to live with somebody with depression. Because when you have depression, the doctors give you medication that sort of blur out your mind, you know. Most of you are like blur already every day, so you're happier. You're happy and blur. You don't know what's happening. But your husband is the one coping with you, with your depression, with your blurriness, with you not interested in taking care of your children and everything else. The husband, actually, that's why I always pity the husband, is because he married that lady, happy, cheerful, lovely, become a lady that is always depressed, depending on medication, cannot control herself very often. Not easy. Not easy to cope with someone with depression. When your husband got any problem, he cannot even talk to you because you're already depressed. The biggest impact is the people around you, your husband and your child. You are not going to be badly affected because most of you will just be so blurred out because of the medication. So that is why it's very important these videos still need to give it to let your husbands read it, share out with the men. The men don't realize the severity of the problem. They don't realize that at the end it's their problem. It's not the wife's problem. It's their problem. Okay? So I guess I finished the first series. Next week we'll talk about another part of maternal emotional health. Next week I'm going to talk about the effects of mother's emotion during pregnancy on the baby's future outcome. Okay, something that nobody talks about again. Nobody cares if you're happy or sad, but they don't realize that it's actually affecting your baby. And when you hear this talk, I've given this talk a couple of times in public forums, and a lot of mothers do realize it. Actually, oh, no wonder my child is like that. Same with some of the mothers in my clinic. Sometimes I tell them, like, I had one lady, she cannot understand why the child is so scared to even go on a swing or a slide or play in the playground. Then I told her, that's because when you're pregnant, you're always scared, no? And now your child is also scared, no? The mother thought the child got problem, go and check, got autism or whatever. Nothing. The child is scared because the mother is scared for 9 months. So these things I'm going to talk about next week, and why it affects and how it affects. Okay? So let's see some of the questions that you all have posted up today. So let's create more awareness on this maternal emotional health. Please share to as many people as possible. Let your husbands read it, let your brothers read it, let all husbands know this, because the biggest impact actually is on the husband. If your wife get depression postnatal and doesn't recover from it, the main person suffering is actually the husband. Amy asks, if have anxiety disorder and experienced depression before, is it high chances to have postnatal depression? Yes, because you already have some underlying. But I'm not so worried about people who already have anxiety and depression, because many of you are already taking medication. Let's say you already have depression, or you already have anxiety, you are already taking medication. So many of you, sort of because the medication control you, may not make things worse after the delivery. But it's those women who are originally okay one, you know, they're okay. So if they have no major problem, it's quite sad. At the end, they get depression. So these are the group of mothers that we should try to identify and should seek treatment early. 9 months, ma. You have 9 months to settle this problem. Last time I had this one interesting lady with anxiety disorder. She was always on medication, but pregnancy, somehow she decided to stop it. She's so worried that the medicine will affect the baby, but she still have her anxiety. So I told her, you better go and see my therapist. And she very diligently see my therapist. In fact, she see my therapist every time she see me. She come to my clinic, she make appointment with me, she make appointment with my therapist. So every month she see my therapist. And that could keep her anxiety level to a baseline level that is very minimal and mild. And thankfully, she went through her whole childbirth, postnatal period, smooth sailing. No problem at all. She could breastfeed. She didn't need to start her medication at all after that. If not, also we worry. We also worry about depression that can come, because anxiety and depression is very linked to each other. So if you have some amount of anxiety, you may also have some amount of depression. But anything that happened during childbirth, postnatal, can just tip you off. So this one lady actually seen my therapist for like more than 10 times. May I know how do I get in touch with with a therapist? There are many. You can either, of course, go to a pure psychologist center. There are a lot of psychology center around in Klang Valley, especially. Other parts of Malaysia may not be so easy to find, because Malaysians tend to avoid seeing these people, except in KL, where some are a bit more open. There are a lot of these type of centers around. You can Google around and look. Of course, we have it in our center as well, in my clinic. Then you can just call my clinic to make an appointment if you need to. Jen said, it has been 1.5 years since I gave birth, and I have developed anxiety, but some doctors just dismiss it and blame my lack of sleep. Is it safe for me to seek a psychiatric medicine while breastfeeding? We normally say that women who need to take anxiety or depression medicine, we still ask you to take even when you're breastfeeding, because we weigh the risk and benefit. I'm not saying the medication is 100% safe, but we are weighing the risk and benefit. We rather keep you well so that you don't harm the baby, than because if you take medication, you're okay, you won't harm the baby. But if you don't take medication, what if you harm the baby? But of course, when we see therapists, then we are not talking about medication. When you see psychologists or therapists, we are not talking about taking medication. We are talking about seeing people who do therapy through talking. You know, sometimes simple things, anyone can do it. You know, sometimes when you're sad, you cry, then you meet your sister or your best friend or your husband, and you talk to them, you cry to them, They say some comforting words and you feel better. That is what we call psychological therapy. So when you see a therapist, that's exactly what you are going to get. But the only difference is they are professionals. That means they know exactly what to say to you to give the right impact on you. You know, that's why sometimes when you cry, especially you talk to your husband, it's always the husband. And the husband don't know say what make you more angry, right? Many women will think that way. You're not happy already. You talk to your husband, you're more angry. That one because husband is not professional, ma. He doesn't know the right thing to say for all situations. Sometimes he knows, sometimes he doesn't know. He say the wrong thing become worse. Because my clinic has therapy sessions, so I'm also partly exposed. Actually, it's not that difficult to learn to be a therapist, but you need to have a certain nature. You need to be those who can understand people's suffering, empathetic, and identify where their suffering is to know what is the right thing to do. So they have actually fixed things. One it's like somebody die, you must say all these things. If the patient is sad, you must say all these things. If the patient is angry, you must say all these things. Yeah, you know, they have sort of a set guideline what to say and what not to say. So that is why they are professionals. So when you talk to them, they know what to tell you and how to talk to you to change things. Like you are scared. Anxiety usually got fear. But of course, they don't just simply talk like that. They always have to dig the point of fear or the root cause of the fear. Like, if you remember, I had one talk on fear of having sex. Fear of having sex, they are fear of having sex, but they're not going to deal with your sex, you know. They want to find the root cause of why you fear sex. Maybe it's a movie you watch. There was one lady that came to us. She watched the movie on Masuri, how Masuri died, where they stabbed Masuri from vagina up. She saw the lady being stabbed from the vagina as a child. And that has already traumatized her. And that's why she's very scared of having sex. She's very scared of anything going into her vaginally. So, the therapist identify her fear, her anxiety, the root cause is that movie. So they will deal more about the movie rather than the sex. When you solve the fear from the movie, the sex settle. Yes. So these are the therapies that they do. Okay? That is to give you an idea how it works. Because for true anxieties and depression, it's not something like just talk to you, feel worse and you feel better, you cry, you feel better. It's not so simple. It's quite deep. Shanice asked for the phone number of my therapist in my clinic. I always cannot remember my therapist number, but I think if you want to seek therapist, you can always just call my main line 012-322-9820. WhatsApp, yeah, don't call 012-322-9820. Actually, I can find for you as well. I don't remember this number by heart, but I have it in my phone, obviously. Okay, if to WhatsApp directly to make appointment with my therapist, 016-336-7612. 016-336-7612. Okay? Shanice asks, are there any specific therapy given by your therapist for people with depression like cognitive behavior therapy? Yes, we have. Because they are all psychology background, so we use all this, we call this psychotherapy. Psychotherapy, there are many types. What you mentioned is cognitive behavior therapy, that's one of it. Of course, there are more. So basically, we do use all kinds of psychological therapy that we think is best for the client. So basically, we look at individual cases. Vivian Ko says some husbands, when not supportive to wife during her pregnancy, may also get her into depression, right? No. First of all, you need to have underlying depression. Let's say if I am not having any depression at all. My husband is not supportive. I may be sad. I may be sad. I may be depressed. But I may not have depression. There's a difference between being depressed, sad, and depression. To actually enter into depression, you have to, as I mentioned earlier, the signs, disinterested in the whole world, don't want to go out, don't want to meet people, don't want to eat, don't want to sleep, cannot sleep, and these type of things are depression. So in order to have depression, you need to have underlying depression first, and then if your husband is not supportive, of course you go into depression. But first of all, you have some depression. And that some depression is not due to your husband. It's due to something else. That's what I learned from my therapist. There's always something else. And we have to solve the something else first before we can solve your husband's problem with you. I know these topics, as usual, as I mentioned earlier, not many people believe in this or regard this seriously, but it actually has a lot of impact to both the family, the person itself, the husband, and the children. So I hope all of you will try to share this video to as many people as possible to create awareness, so that these women do not go into depression, so that I no longer need to see women who slowly change over the next 10 years, 20 years when I see them. It's quite sad when we see them become a different person, because we know we missed the chance to help them already. So please share this video to everyone, okay? And if you want to know more on more related topics on maternal emotional health, stay tuned over the next few weeks. Over the next few weeks, I'll be talking all about maternal emotional health and how it affects themselves, their future, and their children and their family. Okay, so thank you for now, and don't forget, anything you want to watch, go to my YouTube channel, Dr. Tan's City Clinic. Yeah, there's one last question that come in is it true this kind of mental illness can be genetic? No, it's not genetic, but growing up in a family with depression is one of the problems that cause you to be having depression. Because as I mentioned earlier, the baby needs care and love from the mother from the moment the baby is born, to develop the baby from every aspect, including their mental health. So if you grow up in a family with depression, you lack this thing. A depressed mother can never love and care for the baby fully anymore. So because you lack this, that can result in you forming this depression in the future. You stay tuned on next video. Next video, I'm going to talk more about all these things. How the mother's emotion affect the baby and why. Okay? So that's all for today. Stay tuned next week, same day, same time. Bye.